so guys, now we're going to talk about the vestibular system. So just like everything else, the vestibular system develops in a specific order, okay? So we have utricular development, saccular development, and then we get semicircular canal development. And so first we need to kind of understand what's going on with these things called the utricles and the saccules, which is collectively called the otoliths. And so your utricles are going to be your linear side-to-side acceleration like this, and then your saccular are going to be your saccules are going to be your up and down acceleration like that. Now, just one little quick and dirty way to remember which one does what is if you kick a man in his sack, he jumps up. That's saccular activation. Okay, so that's one way to always remember saccular versus utricular activation there. And then after that, then we start to look at semicircular canal development and activation from there. So again, still staying in this neurodevelopmental trajectory of development here. So now, what we need to know is when we're working with our patient, we always know, okay, we need to work in this hemispheric model, but how do we know which side of the vestibular system do we need to work on? One of our favorite tests is called the PostRotatory Nystagmus test. Okay, so I'll explain it and then I'll demonstrate it. So the PostRotatory Nystagmus test is going to be 10 spins, and we're going to reference clockwise and counterclockwise. We're going to need to do 10 spins clockwise, and then we need a fast stop. Now these are fast spins, not slow spins. A fast spin in the textbook is defined as 1 revolution per 2 seconds. I like to at least go 1 revolution per 1 second to get a good test. That's not super important. What you really need to know is you need to do the same speed to both sides, because we're going to compare clockwise to counterclockwise. So I'm going to spin Nolan 10 times clockwise. I'm going to stop him quickly. Now when I stop him quickly, what's going to happen after the clockwise spins is the fluid in the inner ear is going to shift to the left. Okay, the kinocilia or the stereocilia are going to bend towards the kinocilia in the left vestibular system, and you're going to fire the left vestibular system. That in turn is going to fire the right vestibular cortex. And so when we spin clockwise fast with a fast stop, we're testing the left vestibular system and the right brain. Okay, and so just the same, what we're going to be looking for, by the way, when we stop is we're watching the eyes. Okay. Again, this is called the PostRotatory Nystagmus test. We're looking for a horizontal type of nystagmus, okay? And so when I stop him and the eyes start to move in that horizontal nystagmus, just like that, I'm counting not how many times the eyes are moving, but how many seconds are they moving for, okay? So if we do this per the textbook, okay, perfectly per the textbook, those eyes should move for 8 to 12 seconds, okay? That's going to be perfect. Now again, we're looking to compare right to left or clockwise to counterclockwise. And then we're going to do the other way. Again, we're counting. How many seconds do the eyes move? What we're looking for is when we spun him clockwise versus counterclockwise, which way did the eyes move for the least amount of time? That's going to tell us the weaker side. And then that's going to be the therapeutic side and the way that we can then base the rest of our care from there, okay? So let's go ahead and demonstrate. So we're going to spin Nolan.
My legs up or just down?
And pull him up. There you go.
Like
all right.
That?
Just like that. All right, here we go. All right, don't puke on me, Nolan. I'm just kidding. All right, so by the way, the vestibular system should be fully developed by about age 17. And so typically we're not doing this test in a lot of adults because they will probably get dizzy. Obviously, if you're working with someone that has developmental challenges or has a brain injury, then obviously we can use this in those scenarios. But for your average person, if they're 17, 18, plus years old, I may not do this test, but that's just another little piece of information. All right, here we go. Sit down. Here we go. So we're going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're looking at the eyes. Look off into space for me. There we go. Okay? So we did not get a whole lot of movement there. I saw just a few ticks. Okay? not much movement in his eyes, maybe 2, maybe 3 seconds, okay? I have a feeling Nolan's going to have a bit of a right brain deficit here. I do live with him, so I'm fully aware of what's going on with him. So another thing to ask the person, again, you notice he stared right into my eyes, and I said, look off into the distance. Gaze fixation can actually negate that nystagmus, okay? If you really have, strong enough frontal lobes, you can come in and you can actually negate that nystagmus, okay? And so sometimes if the person just can't help themselves and they're staring right at you and they just can't do this right, you can actually have them close their eyes, and then you can see the eyes actually moving underneath their eyelids. That's another little trick. Now, you can also say, are you dizzy? Were you dizzy when I stopped you?
Not too much.
Not too much. If those eyes are moving, he's going to feel dizzy. Okay, and by the way, just another little trick to help you not get puked on. If they're super dizzy, okay, put your feet down. You can say sit up straight, and you can put a little bit of pressure downward into the head and neck, just like this, and we can do a little cha, what we call cha-chas. We can go cha, 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 cha. It's goofy, I know. Cha, 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 cha. If they're really dizzy, like turning green, and they're about to puke, stop. Grab them here and actually lift the head up a little bit, okay? Or here and lift the head up a little bit. What we're doing is we're afferentating the brain through all those sensory receptors in the spine, and it'll negate that effect there. You can also take the wrist right here, pericardium 6, and slap the inside of the wrist like that. Oftentimes it'll shut off that motion sickness feeling. As you can tell, I have been puked on a few times. Okay, so we just tested clockwise. Okay, so we tested clockwise. Eyes only move for maybe 2 seconds, maybe 3 at the most. He said he really didn't feel that dizzy, okay? So we need to make sure that he's nice and settled. His eyes are not moving anymore. He doesn't feel dizzy. And now we're going to test counterclockwise. Again, notice I'm saying clockwise and counterclockwise because if we just start saying left and right and you're going, well, wait, is that his left, my left? Which way is he facing? Just say clockwise is testing right brain, left vestibular. Counterclockwise is testing left brain and right vestibular. Okay, so now go ahead and assume the same position. There we go. And now we're going to test counterclockwise.
Stick off.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Are you dizzy? Oh, his eyes are moving though. 3, 4, 5, 6, 7, 8.
What? I'm not.
So they're done now. Okay. So his eyes move. They had that horizontal nystagmus for about 8 seconds. Okay. So remember, textbook says, hey, 8 to 12 seconds. So again, but I'm spinning about the same direct speed.
You were speeding up at the end. It felt like you were speeding up.
Okay, was it dramatic enough to make 2 seconds versus 8 seconds in your eyes? No. The answer is no. Thank you. So we do see a pretty dramatic effect right now in Nolan. When we go clockwise, we do not see much eye movement. We do not see much nystagmus. We do not see much dizziness. That's going to be the therapeutic way that we need to spin him. So for therapy, we need to spin Nolan fast clockwise. We can also spin slow counterclockwise. Let's talk about that. So same thing, if I spin him fast clockwise, so if we are doing therapy like this, that's great. And when I stop him, boom, the fluid in the inner ear shifts to the left vestibular system, starts firing the right brain networks. Guess what else we can do? We can grab our laser, we can put it on the cerebellum setting when we stop him, and we can laser right there for the cerebellum. We can put it on the right PTO setting, and we can laser that right vestibular cortex in the parietal lobe. Okay, so we can do that. Now, what we can also do is we can go slow counterclockwise. Okay, when we go slow counterclockwise, we're just slowly starting to stimulate that left vestibular system. Different mechanism, okay? Same type of effect, different mechanism. Another way to add stimulus here, we can give Nolan the Focus Builder app. We can put a purple and blue hemistem in front of him, spin him fast clockwise, and then we can actually do slow pursuits to the right with a blue or a green dot while we slowly spin him counterclockwise. You follow that? So, again, to add stimulus to this, we can put a blue and purple hemistem, have him stare at that, do fast clockwise spins, and then we can stop him and laser him like I just talked about. And then we can do slow, smooth pursuits to the right while we slowly spin him to the left. Okay? That would be really good therapy, especially in the office, but can absolutely do that in home. Now, since we know Nolan has more of a right brain deficit, okay, and we need to stimulate more of the left vestibular system here.
Where? I thought the left brain.
You are.
Yeah.
That's why we're stimulating your right brain and your left vestibular system.
Okay.
We can take a stimulus like the Resimax. We're going to turn it on. I'm going to turn the vibration up. The color blue stimulates the right brain. Okay? So, Nolan, you're going to hold this in your left hand because the left side of the body is talking to the left cerebellum, coming over and talking to the right brain. Now, Nolan, hold that right there. Keep your eyes fixed on that blue dot for me, okay? Keep your eyes on that dot. And now we're gonna quickly turn your head to the left. Keep your eyes on that dot. And we're gonna slowly come back. And we're gonna turn your head quickly and slowly come back. This is gaze fixation with VOR, vestibulo-ocular reflex. Do it again. Do a quick head turn left, slow back to the center while he's looking at that blue dot. Now, there's some ways that we can magnify this. What we want to do is we can actually use acoustics. So the vestibulocochlear nerve is what we're targeting here. So what we need to do is put some acoustics into this left ear. We can put an earbud. You can use the neurosage system to really specifically target this area while you're doing these activities. You can just get a phone and put 128 hertz next to the left ear while you're doing these types of activations. Another thing that you can do is actually use just a sock, right? This is a sock that one of our practitioners in Australia, Genevieve, actually sent me. I use it in the clinic all the time, Jen, thanks a lot. And so put just some rice in there, throw it in the microwave, get it warm, obviously not too hot. And what you're going to do is you're going to use this as a form of warm calorics. And so I'm going to put this on his left ear, again, for a right brain deficit. Hold that up again, Nolan. You're going to keep your eyes fixed there on the blue dot, and we're going to do the same thing. We're going to do a quick head turn to the left and slow back to midline, but now we're adding warm calorics for added stimulus. And again, after we do that type of activation, come in with your laser on the cerebellum setting, and we're going to laser the cerebellum here, and then we're going to go to that right PTO setting and laser the vestibular cortex there, just like that, okay? So we can continue with this with some barbecue rolls, which are always fun. Can you get down on the floor for me, bud? So just lay on your stomach with your head facing that way. All right? Scoot over to your right a little bit. Okay, so that's not the way we want to go. So the way that Nolan needs to barbecue roll is to his left. So roll this way. So he needs to do barbecue rolls just like this. Fantastic. Now stop. Now get up. We don't want him just to roll back. Go ahead and get up and walk back over there. Lay down on your stomach. And now barbecue roll back.
This is like ultimate burpees.
There you go. Okay? So those are the barbecue rolls. Now, something that is a very, very, very strong stimulus. Nolan, can you lay on your side? I need you to lay with your right ear up. Your right ear is up. Okay? Now let's talk about cold calorics. Okay? Now, this is definitely more advanced and definitely not something that I want a lot of the home users to jump right into. This is a very strong stimulus because what we're going to do is we're going to use ice cold water and we're just going to demo it. I'm not going to actually do it on you, okay? But we're going to use ice cold water, and when we put the ice cold water with a syringe into his right ear, okay, into the right ear, what happens is we actually effectively increase the temperature of the left side. So it's just like using a cold caloric on the left, right? So if we need to stimulate the right brain, we need to put cold calorics into the right ear, just like that, okay? So it'll look like this. So roll on your side, Nolan, just like that. And again, we'll have ice cold water. We'll put a few drops into the ear, okay? And what's going to happen is he's going to start to get dizzy, obviously. And by the way, cold calorics will stimulate the vagal system more than the warm calorics. And really it'll stimulate it more than the other things that we've been doing. So this is a very strong vagal stimulus too. Okay, so when we put the cold water in his right ear, we start to stimulate the left vestibular system and the right brain. Now, what's going on is the eyes will again start to produce a nystagmus. The fast phase of the nystagmus will be towards the overactive or the more active vestibular side. So we should get a left fast phase nystagmus out of this procedure right now. Okay, so we put the ice cold water in the right ear. We're looking for that left fast phase nystagmus, and we're going to give it 10 to 30 seconds, and then we're going to put a cloth or a paper towel here. We're going to roll him. We're going to let the water drain out of that ear, and while we're doing that, again, we activated the left vestibular system. That's a great form of co-activation. While we're here, we're going to laser behind the left ear. We're going to laser the cerebellum just like that, okay? And again, we're going to wait for his eyes to settle. We're going to wait for him to not be dizzy anymore. In those severe imbalances, what you're going to see actually is some normalization. It's really cool. So I was working with a kid one time with this really bad spinal curvature, and we were doing this, and it was really interesting because what happened is when we actually started to balance his vestibular system in this position, his spine would straighten, and he had this really nice even posture, and you could even feel his muscle tone completely change. It was a severe pediatric brain injury, and then as it started to come back, he started to tilt again, and so it was just amazing to see, you know, that dramatic of an effect with this procedure. So, all right, so those are calorics, and now that is, you know, those are some really powerful therapies that you can do in the practice. You can do at home. These are great for home care. The vestibular system is a very, very powerful system. And if you start to do these things at home with your child, you start to specifically target the weaknesses. Again, using that PostRotatory Nystagmus test, and you specifically target these weaknesses, you'll start to see some amazing things happen. This is also something that's really important to do for the fear paralysis reflex and for the Moreau. Okay, so the vestibular system can come in and start to inhibit those dorsal vagal centers and start to really inhibit that fear paralysis, so that kid that doesn't like to go in new places, likes to run away, likes to fight, is constantly in fight or flight mode. These are some really easy ways that you can be doing these, you know, on a daily basis, just to stimulate these systems and to calm that down.